Hello and welcome to the Canary Brief. They make me wear this. From the very beginning of the coronavirus outbreak in the UK, the Johnson government has insisted it has been following the scientific advice. But a group of leading scientists are about to prove that isn't the case. So when Boris Johnson and his ministers say they're following the best scientific advice, any journalist worth their salt should ask two questions. Who is advising you and what are they saying? But in April, the government told us we're not going to answer either of those questions. So what normally happens is we have this group called the Scientific Advisory Group on Emergencies, and they are supposed to be the leading scientists in the country coming together to give the government the best possible advice on how to manage an emergency, be it a pandemic or a hurricane or a fire or a terrorist attack. But the problem is, when the government was asked who was on the Scientific Advisory Group, and what advice were they actually giving the government so that we could test that against what the government was actually doing? They just said no. And seriously, how the hell are we possibly supposed to hold the government to account and assess whether what they're telling us is actually true if we're not getting access to that scientific advice? And so a group of Britain's leading scientists came together to form the Independent Scientific Advisory Group on Emergencies. And rather than me tell you what they do, here it is in the words of the group's chair, former Chief Scientific Advisor, David King.
We are a very dynamic little group. And although we've only been working for a week as a group, each one of the people in the group has been working for very many years. So there's many years of experience. We also come to this from very different ranges of experience. We are demonstrating what it looks like to do this in the public domain by having our meeting last week available to the public to watch, by having our publication open not only to the government, but also to the public by immediately we've sent it to the government, having this press briefing. All of this is to demonstrate what an independent science advisory group should look like. In other words, it took a bit of pressure from us before we saw any of the minutes of SAGE. We were told that the membership of SAGE was secret. Why on earth would you want to be secret? What we are focused on is delivering what is in the best national interest at this point in time and doing it openly so people can judge whether or not the government is following the best advice.
What we wanted to do was to make sure that our advice, our expert advice, which was transparent, was clear, and was looking at all of the evidence, the social, the economic, and the health evidence, and looking at the interrelationship with that. We also, and in fact, we've made a recommendation about this as well, is that we also wanted to ensure that even communities, as well as the third sector organizations, civil society organizations, also get a voice and say in this pandemic.
And the reason the work of Independent SAGE is so important is because it appears that the scientific advisors that are coming out and standing next to the government in these daily briefings are making statements that are rather more political than scientific. And I'm going to give you a really important example of that right now. Early in March, when the government was under a lot of pressure to lock Britain down, Jenny Harries came out and was saying that lockdown might not be appropriate for the UK.
And in fact, the government here is being extremely careful and has been planning for months to ensure that we follow science. So I think the only reason that we would do that is if the science tells us to do that. Just because a lockdown is imposed doesn't necessarily mean that that is the right thing to do.
And really, there was literally no scientific justification for that argument. Scientists at this point across the world, including the World Health Organization, were advising the precise opposite. But there's another point. On the 12th of March, the UK also stopped contact tracing. Now, contact tracing is one of the three pillars of the established global approach to suppressing the coronavirus. Where there's an outbreak, you test people, you find out if they're positive, and then you do something called contact tracing, which is you just find out where that person has been and who they've been in contact with, so that you can then consider that whole group of people at high risk of having the virus, and you then test those people, and you then isolate those groups of people for 2 weeks, and in that way you completely suppress the virus. It's impossible for it to continue forward because you've found it, you've isolated it, and that's it. It doesn't breed on its own. It has to be carried off into other human beings in order to spread. But for bizarre reasons, on the 12th of March, the UK stopped its contact tracing exercise. The most successful nations in suppressing this virus, doing everything they could to ramp up capacity for testing and contact tracing. The UK government did the exact opposite. They stopped. And the reason given by Dr. Jenny Harries was that contact tracing just wasn't appropriate in the UK context. But 6 weeks later, appearing before the Public Health Committee, Jenny Harries said the exact opposite. She revealed that actually the reason that the UK suppressed its contact tracing programme in March was simply because it didn't have the capacity. Essentially, they lied. They told us we didn't need to do it, when the reality was they didn't want to do it. And don't believe me, here's Alison Pollock to explain just how absurd that piece of advice looks.
It was a puzzle as to why contact tracing stopped on the 12th of March. And we were given two reasons: that it wasn't effective and there weren't sufficient resources. They seemed to be linked together. By the time it stopped on the 12th of March, only 3,000 contacts had actually been contacted, and of those, there were 120 confirmed positive cases. So considering the population of the UK, I think that shows you how things were. And what we do know is part of the reason for the contact tracing not continuing was that Public Health England only was operating out of 8 regional hubs serving 343 local authorities. So it just didn't have the capacity. But contact tracing is the bread and butter of public health, and it needs to be done locally and in local communities, which is what we're arguing. You have to understand your local community and the extent to which they're able to comply with isolation and quarantine and their living circumstances. That's really important. So it was a great disappointment that the government has not rebuilt capacity over the last 2 months in local authorities, which are the best place. There are no health bodies, area health bodies anymore. Public health is sitting in local authorities, but unfortunately, communicable disease control is in Public Health England, so you've got extraordinary fragmentation. But what the government could have done, and we hope it will still do, is rebuild contact tracing locally through teams. Now, it's not difficult to do contact tracing, but you will need tens of thousands of people. But after all, there are 750,000 volunteers, and that could be done locally with local authorities rebuilding the contact tracing teams with environmental health officers, with GPs, having community monitoring in place so that people receive packs of thermometers and also oxygen saturation meters that can be recycled, and they receive the support to see whether they can get isolation. Because, as you know, this is not one national epidemic. It's really, to use the fire analogy, it's thousands of outbreaks that are going on. And when you want to put out a fire in Blackpool or Cumbria or the Isle of Wight, you don't actually call the fire engine from Westminster and London. You have to do that locally. And that way you engage, you understand your local communities, and you make that work. Of course, contact tracing is a package of measures, and you can add to that testing and apps. But it's very bewildering, the government's decision to outsource contact tracing to Circle and to have a centralised system. This doesn't make sense. The centralised app, the centralised systems, and the centralisation of laboratory results as well, this isn't making sense.
So far, the new independent SAGE has had 2 meetings, and both of them have had the press in attendance, able to ask questions, interrogate the scientists' thinking, and actually watch the scientists doing their work. And on the 12th of May, they released a report to government, and the report includes 19 tangible steps that government needs to be taking across a range of issues. So this is not just looking at medicine, not just looking at science and technology, it's looking at public transport, and it's looking at the socio-economic factors that need to be taken into account. Because remember, coronavirus is not just a public health crisis, it is also a socio-economic crisis. And for those of you interested in reading the report in full or watching this meeting in full, the links are in the description box for this video. But today we're going to cover some of the key points. The group's key concern was about Boris Johnson's decision to ease lockdown in England well before we were in any position to do so, whether it be our death rate, our transmission rate, or creating the conditions in homes, workplaces, public spaces and communities where social distancing and other measures needed to keep us safe could actually be applied.
The staying alert doesn't protect vulnerable communities, vulnerable groups who have been forced, if you like, to go out to work. Because as I mentioned before, for many people, there hasn't been a choice about going out to work in unsafe work versus having to feed their families at home. So in that sense, it's the staying alert, it's not an appropriate advice for groups that are very vulnerable. And the government is very aware of which groups are very vulnerable. It's not just the elderly. We know it's people in lower socioeconomic groups, lower paid jobs. We know it's particular Black and ethnic minority groups. And in that sense, I think it has been a message that is likely to put more people at risk. And we're very concerned about that. We're also concerned, of course, that there is a disparity between what the rest of the nations are doing in the UK and what England are doing as well.
And Boris Johnson continued to say that his approach to easing the lockdown was based on the science, and that scientific data meant that he would only move forward if it was safe. But as the scientists of Independent Sage explained, without the necessary things in place to make it safe, there's no way that Boris Johnson could deliver on that promise. As Professor Christina Pagel explains, contact tracing on its own isn't enough either.
I just wanted to add to that tracing on its own is useless unless you're going to isolate people who've been in contact with infected people. And although the government talks about it in its report yesterday, it doesn't actually provide support for how you effectively self-isolate, particularly for the vulnerable populations we've been talking about, where maybe you can't afford to self-isolate for 14 days. Maybe you're living in a situation where you have shared bathrooms or there's a crowded area. How is the government going to support people to isolate effectively so that they're not infecting their households as well?
And what we now know is when it comes to coronavirus, we are not all in this together. This is not a virus that is affecting people equally. People in low paid work and people of ethnic minorities are disproportionately highly impacted. In fact, poor people are more than twice as likely to catch and die from coronavirus, and Black people and people from other ethnic minorities are 4 times as likely to catch and die from coronavirus. And yet it was these exact groups of people that Boris Johnson sent back to work this week. And the members of Independent Sage were particularly scathing about this decision.
It does strike me as very unfortunate timing that literally within 24 hours, an ONS report states that there is double the death risk in those individuals, precisely those individuals who cannot work at home and have to go out to work, at the same time as government advice says those who can go out to work should go out to work. And I would support that concern that other members of the panel have about the impact and meaning of the move from stay at home to stay alert.
But we know that the stay-at-home message has been very effective. We know that's what's been protecting communities, vulnerable communities, even communities living in overcrowded, multi-generational homes. Arguably, for them to stay at home is more protecting, is that they've been more protected that way than going out to work. So to some extent, this is a reckless message, and it puts the onus of responsibility on individuals who don't necessarily have all the information to protect themselves in this pandemic.
But I gotta say, far and away, my favourite moment of independent sage was when a journalist on the call tried to make out that these scientists were somehow some sort of left-wing political project just designed to undermine the government. And man, did he get schooled.
Okay, it's Colin Fernandez from the Daily Mail.
Hello, Colin, go ahead.
The membership of Independent Sage appears to be largely people with left-wing political affiliations. Was there any attempt to seek a wider balance of political views in the makeup of the panel? And does this affect at least the perception of Independent Sage as critics of the government?
Very much hope that anyone watching this briefing, anyone reading our report with the kind of detail that it needs to take to read it, will understand that what we've put together is quite simply a range of the best experts available to us who could work on this problem. There was never any point at which we looked at political affiliations amongst the members of this group. And it does seem to me utterly absurd to suggest that this is in any way politically right or left. We don't recognize that, because what we're doing is attempting to demonstrate to everyone in the media what a science group looks like without any political interference with its workings. And that really, I think, has been extraordinarily successful. What you've heard, I'm sure you've been listening very carefully to all of the answers, is the kind of expertise that is sitting in front of you here. So please remember, when you're writing headlines for your newspaper, remember to focus on the science. If you can find any fault with the science, please take us up on it. But to suggest that this is a politically biased group is to entirely miss the point.
I don't know about you, but I have been feeling an increasing sense of terror and doom, realising that our government is clearly not following scientific advice and is actually committing a crime worse even than that. The UK is a world leader in science and in medicine. There is absolutely no reason whatsoever for the UK to have the highest death toll in Europe and the second highest death toll in the world. More than 60,000 people in the UK have now died from coronavirus, according to estimates prepared by the Financial Times based on data from the Office for National Statistics. Those are 60,000 human lives. If we look at nations like Germany, like Japan, like South Korea and others who adopted the test, trace, isolate approach, their victims of coronavirus are numbered in the hundreds. What we're seeing here is an unfolding disaster, and a completely unnecessary one. This is not inevitable. If our government was actually basing its actions and its policy on scientific evidence, we could potentially have the death toll of South Korea, Germany, and others. Every life lost would have been a tragedy, but the difference between a few hundred people dying and 60,000 people dying, a football stadium of people dying, is simply enormous, and it's too enormous to overlook. It is one thing to suffer a catastrophe because you simply do not have the resources or capabilities to fight it. But this is not that situation for our country. We have the resources, we have world-leading scientists in medicine, but those people are not being allowed to do the job that they know they should be doing. And why? Because our government is tied to an ideology which puts profit above human life. That's the reality here. What was so extraordinary as I was watching Independent Sage was being reminded of that. Because although it's enormously frustrating to have that realization that the reason we're in this mess is political, it is not about our ability to actually respond to this virus, then you realize we do have options. We do have options to pressure this government, to topple them if necessary, to fight them all the way, to make sure that these responsible voices of science get the chance to do what they have trained all their lives to do. And that's save lives. I recommend everyone gets on YouTube right now and subscribe to Independent Sage, because they will be having future meetings and there will be future reports. And the good news is their 19 recommendations to government are actually summed up in only 3 pages in this report. So you're not going to have to read a load of dense scientific stuff to get your mind into gear about what a science-led approach to tackling the coronavirus actually looks like. It's 3 pages, guys. I've put the link in the description below. And there is lots that you can do. The very first thing is take those 19 recommendations, copy and paste them into email, get it sent to your MP, and then phone them and ask them why they aren't tackling Boris Johnson and making sure he takes those steps. Because your life, my life, and the life of everyone we know could depend on it. You don't have to sit as a passive observer to this, feeling frustrated, scared, and alienated. We have the power to fight back. So let's do it.